Hi, everybody. My name is Natalie Yeadon. I'm the co-founder and CEO with Impetus Digital. At Impetus Digital, we've built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools. Over the past 13 years, we have worked with life science companies from across the globe to help them build everything from their virtual advisory boards, working committees, medical education groups, publication teams, and everything else that you can imagine. And since the launch of our award-winning Insight Events platform, we've been helping these same companies with their sales training events, corporate hackathons, and all sorts of other large meetings. But more importantly, at Impetus, we really believe that everything starts with a conversation. And from these big, hairy, audacious conversations with some of the leading edge thinkers, the digital provocateurs, the healthcare thought leaders, is we can all work together to collectively and positively disrupt healthcare. But it can't just end here. We need to continue these conversations. And this is precisely the reason we've developed the Insight platform, so we can have these ongoing asynchronous and synchronous touch points with various stakeholders around the table so we can move agenda items forward. So I'm really pleased to have one of these thought leaders in the healthcare space at the table with me. This is actually the Honourable Tony Clement. He is the former minister in the Stephen Harper government federally and the Mike Harris and the Ernie Eves governments in the province of Ontario. During his time in the House of Commons, which ran from 2006 to about 2019, Tony served as the Minister of Health. He served also, this is going to be a long list, everybody, so hold on to your hats. Ministry of Industry, President of the Treasury Board, and minister responsible for the Federal Economic Development Initiative for Northern Ontario. Tony's dedication to public service spans 3 decades. During his 8.5 years as an Ontario MPP, he held prominent cabinet positions in the Ontario government, including Minister of Health and Long-Term Care, Minister of the Environment, Minister of Municipal Affairs and Housing, and the Minister of Transportation. So you've done it all, Tony. As health minister, he successfully steered Ontario through the SARS pandemic. Sounds familiar? And he fashioned the first national pandemic plan. Maybe we should have listened for future pandemic events. He also created the Canadian Partnership Against Cancer and the Mental Health Commission of Canada, as well as implemented the National Heart and Stroke Strategies. And finally, but certainly not by least, was responsible for the launch of the new Canada Food Guide in 2007. In addition, Tony is a business entrepreneur. He's leading and serving as an advisor or chairman for several startup companies. And he's also the host of his own show, Boom and Bust, on the News Forum. Welcome, Tony. So happy to have you on the show today.
Well, Natalie, I'm very excited to be part of your broadcast. So thank you for the opportunity.
Absolutely. So what an impressive background and career in politics. So do tell us, Tony, was this always part of the plan?
I didn't believe in plans per se. I kind of backed into political activity, political involvement, because my mom, who was we were an immigrant family. We came to Canada when I was 4 years old, and my mom became a single mom, and she ended up getting a job, a secretarial job, as they were called then, at Queen's Park in Toronto, working for a member of provincial parliament. So when provincial election was called in 1975, it was either, do something, pass out leaflets and help her boss get reelected, or she might be out of a job. But at the same time, there was, I was a young person, and I became alert to what was going on around the world. And I became convinced that part of what I was about as a person was I liked more freedom rather than less freedom, and more economic opportunity rather than less economic opportunity. And that's why I became a conservative rather than some other political ideology, perhaps. And from there, I just kind of worked my way up through the ranks in the PC party political ranks, and then eventually ran for public office myself and was successful.
Oh, it's amazing. Yeah. And I would love to dig into this because, of course, since COVID-19, the world has just boomed in terms of politics and everything that's going on, but we'll get into that in due order. Just kind of curious, you've had so many different ministerial hats on. I was actually just curious, was there anything that specifically stood out to you in your tenure over the last 3 decades that you thought was really an exceptional experience?
There were so many. You do so many different things. It's one of the great joys about being in politics. Maybe more so when you're in government rather than in opposition. It's always tough to be in opposition. I had my stint in opposition as well, but certainly in government roles, when I was Minister of Health and Long-Term Care for Ontario, launching initiatives. The problem with being health ministers, you never get to be around to enjoy the results of your decisions. You make decisions that are long-term decisions, perhaps, and then somebody else or the population in the future gets to enjoy the benefits of a good decision. So one of the things that I did, I concentrated on primary care reform. So we started up the family health teams, which are very pervasive in Ontario right now. We started having these specific offices for nurse practitioners to lead, in rural and remote areas, and that's become prevalent. I launched the telemedicine helpline. So these are things that are still part of our healthcare system. People maybe take them for granted, but they had to start somewhere. Obviously, after the SARS outbreak, the pandemic that happened in 2003, when I left political office in Ontario, but became the federal health minister after being elected as an MP as part of the Harper government, I more or less insisted that we had to have a modern pandemic plan, that we couldn't be left basically without a plan in place, which is what happened during SARS, for the next pandemic. And so having a coordinating body through the Public Health Agency of Canada, making sure we had PPE stocks in place. I even signed a contract for vaccine development for the next pandemic at the time. And that contract was renewed for 10 years, but alas, it was not in place when COVID struck. So these are the kinds of things you think about, especially during COVID. But even as industry minister, we faced the great recession and the financial crisis, and helping companies survive, whole industries like the auto sector survive that. That was an important part of my role as well.
Yeah, so many great things. We could literally probably talk to you for hours, Tony, because you've kind of done it all. But I wasn't joking when I first suggested the little sarcastic humor there about what happened to the SARS pandemic report and recommendations for change. There was obviously a program in place. There was obviously a plan. We got hit with one of the biggest travesties that has ever happened to this country in probably memory, and obviously across the globe. It hit us between the eyes. We were unprepared. Everything that you've suggested, from PPE to manufacturing of vaccines, supply chain issues, and everything in between, hit us. What happened to that report that you created so many years ago?
I think people just forgot. There was plenty of soul searching after SARS. There were independent reports by commissions and research done, and there was things that were pretty clear. One of the things that fortunately did take place was in our hospitals having negative pressure rooms so that the virus wouldn't spread through the HVAC system. So that at least was in place. But other things that were more or less common sense, unfortunately, did not really take root. I think of our long-term care facilities and making sure that the pay rates for staff were reasonable enough that you weren't taking 2 or 3 jobs just to survive, because the threat during a pandemic would be that those staff members unwittingly would carry the virus to other institutions. And lo and behold, unfortunately, that's what happened. So that was a very common sense recommendation that wasn't followed through on. Having proper stocks of PPE was followed through for a while, and then everybody just sort of forgot about it, and the PPE exceeded their best before date. I made, when I was Ontario Health Minister during SARS, I made remonstrations to the federal health minister at the time, Anne McClellan, and said, look, we've got to have a contact tracing system for people entering our country through our borders, because this is how we got SARS. People came from Hong Kong and China into our country, and they transmitted SARS. So we have to have these things at our border to make sure that we can track and trace, and maybe even prevent some people or quarantine them if they show signs of infection. And yet nothing was done for round 2 with COVID. So I hope we do learn the lessons this time. There are other countries that have learned the lessons better. Taiwan was hit by SARS. They closed their borders to China in December 31st, 2019, when COVID was starting to be chatted about in China. So there are things that you can do. I'm not saying, we live in a world where people are going to travel. We would never be completely free from the impact of COVID, but maybe we could have bought ourselves some time so we could have the PPE in place, and we could have the proper situation in place in our long-term care facilities. We could work with our life sciences industry to get started on vaccines. And unfortunately, we had to wait too long for all of those things.
I think what's interesting here, Tony, is that for many, many, many years, we have not lived in the digital ecosystem that we live in today. So there's possibilities, if you will, excuse my use of the word, backroom politics and other sort of filibustering and other kind of, short-term thinking that has really infiltrated the way our government works. Now things are a little different. Not only was this pandemic experienced by the entire world, but we now are exposed at our fingertips the ability to get access to a global scorecard. We are literally being graded versus everybody else's reaction and rejuvenation, if you will, of their economy and of their health status. How is Canada faring, in your opinion? And what lessons can we learn in the new world that we find ourselves?
Well, you raise a good point, Natalie. This is so different from 2003 with SARS, because you're absolutely right. People in real time have access through social media and through all of the media platforms to what's happening. So I've been monitoring that, and of course, my opinion has been asked by various media outlets and news organizations. And I would give Canada a kind of a fair to middling score. I mean, we definitely were not the absolute worst on any of the criteria, and we were certainly not the best. Now, we're a G7 country. I would argue that we should be near the best or the best. We've got the world-class scientists, and we've got robust democratic institutions and a healthcare system that obviously needs work, but is one that we can be proud of. And yet, there were times, obviously, when our caseload did not reflect that. And then, of course, with vaccine deployment, we were months behind the more successful countries. And yet there were countries that were behind us. I look at Australia now, that has to go endure more lockdowns because their vaccine deployment was lagging ours. So I think there are lessons to be learned. This is not a question of what can we be proud of or what we should be ashamed of. I think it's let's learn the lessons. There was a plenty loss of life here, and there will be a next time. Everybody is saying that, and they're correct. So, and this, unfortunately, COVID is going to be around for a while. It looks like it's not going to disappear entirely. It'll continue to mutate. So yes, we have to be able to protect ourselves to the best of our ability. And the only other thing I'd say is, I was supportive of lockdowns, a year and 4 months ago. I thought it was given that there was no vaccine, and given that this was spreading so obviously through ripping through various communities in our country and the world, sure, lockdown, but we have to come to a point where we can, as safely as possible, open up because of all of the other aspects, the costs of lockdown, mental health costs, addiction costs, spousal abuse costs, education costs, lack of education for our kids. All of these things are all piling up. And so we've got to find a way to not be locked down and yet be as safe as possible.
So it's very interesting because at the end of the day, somebody can say that there has been a push-pull with a kind of a zeroism reality for some people, that there should be some sort of a zeroism, and at the end of the day there has to be some sort of a balance. There's a bioethical issue here. Are we just too afraid to engage in that conversation?
You know, it's very interesting. You should put it that way. I think that's an interesting way to look at the situation and look at. Again, it's easy to find fault with government, and I was in that position, so I've given them a lot of latitude for some very tough decisions that had to be made, and governments spent their time informing the public about how serious the situation is, because they were facing deniers and people that didn't take it too seriously or what have you. So I get all that. At the same time, you know, at some point you've got to have a discussion about cost versus benefits. So I guess if we all remain socially distant forever and didn't have any economic activity, there may become a time where COVID would be defeated. But of course, that's not realistic, nor is it desirable. Because of the huge economic costs, social costs for large elements of our population, usually the ones who are of modest incomes, by the way. If you're rich enough, you can always use your private jet to fly anywhere you want and not worry about social distancing rules and not worry about economic activity. But for most people, that's out of reach, and so you need to work in the real world. And so, yeah, I think we have to have that discussion. They're starting to have that discussion in other jurisdictions. The UK comes to mind, where Boris Johnson, the British Prime Minister, has said, look, we're going to open up on July 19th. Yes, we know there are going to be further COVID cases, but we're going to have to live with it as best we can and use our best judgment as individuals to define our safety, which is kind of what we're used to doing in most free and democratic societies. We don't want to be in a state of perpetual lockdown. It's not going to work.
Yeah, so it's sort of delving further into some of your long tenure and still your vested interest in healthcare today, is what I think has been very interesting about the pandemic. Not only do we have a global scorecard on just how in general we were doing with vaccinations, et cetera, but I think also the way information was being reported. So just looking at this as a thought experiment for a second, if we think about the way the US handled it, when we take a look at net or absolute numbers of things like number of cases, number of hospitalizations, number of deaths, and we compare that per capita to the way Canada explained it. Personally, I think that the core difference was that there wasn't a panic, and Canada came more from it from the standpoint of we're getting inundated at the ICU level. Right. As opposed to if one was to do a direct per capita number of cases, number of hospitalizations, number of deaths, I'm sure the US would far have surpassed Canada. Does that say anything to you about the way healthcare is paid for, administered, our healthcare system versus the US? And is there something to be said about private healthcare, i.e. people might have been making money on COVID-19 in the US?
I would say two things. My first observation from your remarks is I 100% agree with you that most Canadians, when trying to determine how well or poorly we're doing, the factor that they always looked at for the last year and a half is what was happening in the USA. And when President Trump was president, there was a general feeling that the US was just going mindlessly from pillar to post on COVID. That there was COVID as a topic was politically weaponized in that country, so that if you were a Democrat, you believed in masks. If you were a Republican, you didn't believe in masks, and that was no way to have the debate about masks. Let's put it that way. So Canadians looked at that and said, we don't want that. We don't want to be like that. We don't want to do like that. And so there was a certain amount of, as usual in the Canadian psyche, sense of superiority, that we were more in it together. There was more of a social and political consensus of moving forward, and not sort of disregarding social rules, not Now, there are elements that didn't like masks and didn't like lockdowns, but it's a relatively small element in Canada. So I think that that's where Canadians' heads are at, and all the polling indicates that indeed most Canadians supported lockdowns and were willing to bear that cost for additional safety. So that's part of the Canadian psyche. We're more safety conscious, perhaps, than the Americans, and not willing to balance that off in the same way that Americans are with freedom, let's say, or whatever that term means. So what does that mean about our healthcare system? Well, as I said, the healthcare system has some issues that have to be addressed. I mentioned long-term care, but also vaccine development, supply chain. We can talk a little bit more about that. I'd certainly like to, as a co-founder of Reshoring Canada. And also ICU. This is the thing that really frustrated me, was that the thing that was driving lockdowns was we were hitting our limits on ICU. Where was the plan to increase our ICU? The plan always was, we're hitting our limits on ICU, therefore we're going to lock down society. Well, at some point, you got to stop playing that whack-a-mole and say, okay, if the problem is the ICU, now you can say, where are we going to find the doctors? Where are we going to find the nurses? I get that. It's not an easy topic, but shouldn't that at least be a point of discussion rather than, okay, we're at our limits in ICU. I guess that happened again for the third time. Let's lock everybody down. At some point, you have to look at the structure of the healthcare system and see if there's a better way to expand, even temporarily, ICU capacity when you're dealing with a crisis. And I'm sure that once we get the inevitable review of the situation post-COVID, that's got to be one of the recommendations, because we can't be in a society where everything seizes up because of ICU capacity. You got to deal with the problem. The problem is ICU capacity.
100% agree with you. Absolutely. And that for me was a core differentiator, really, in my opinion, between the US and Canada, was really about the ICU numbers.
Yeah.
And really, like I said, it paints the picture of the differences in our healthcare system. I think it really did sort of open the door, show the blemish behind that. So on that note, has it opened up a Pandora's box? Has it revealed to the average Canadian consumer, who always believed that we had national pharmacare or some rendition of it, without really fully understanding what was covered, what's not covered, compared to other counterparts? Has it revealed things that need to be worked on? And what are those things that are blemishes, and that we need to actually make, that we need some major changes with?
Well, I think, Natalie, and I hope through this broadcast, amongst others, that dialogue starts to happen with a wider group of people. Certainly, policymakers are aware of these issues. Certainly, the political class is aware of these issues. And certainly, I hope that people are starting to wonder, what are the lessons learned from this national and international crisis? Because it would be a shame to have gone through all of this with all of the lost lives and disrupted people. And, I lament for a generation of school students, how they're going to catch up and all this. To go through all of that and not learn some lessons would be criminal. So yes, I think that it is important to have that dialogue. It does involve the state of our healthcare system and its resiliency in the face of a crisis. Because, I mean, if you could say, well, this happened, it happened in 1919, and so it won't happen again until 2119, I think that would be absurd to have that point of view, that this is a once in a 100-year crisis. The way pathogens move around the world now, this could happen next year, 2 years from now, 5 years from now, who knows? But it's going to happen again, and we have to make sure that our systems are resilient, including having access to things that are going to protect us, whether it's ventilators or gloves, gowns, masks, and of course, vaccine capacity. If there's one lesson from looking at it from a broad geopolitical, that was a lesson I never would have thought we'd be learning, Natalie, is that we I guess all assumed that the trend in these kinds of issues, environmental issues, healthcare issues, geopolitical issues, are for increasing international collaboration, right? And I look at climate change. Clearly, the only way that anything's going to get done is through increased international collaboration. Well, COVID has been the big outlier on that, where as soon as COVID became worldwide, nobody said, let's give the World Health Organization more power and authority, because quite frankly, that was very controversial to give them more authority, because there was a concern, quite frankly, that China had an outlying interest and influence on WHO, which was not helpful to the rest of the world. And that debate is still ongoing. So all of a sudden, when people are faced with this international crisis, when governments, I should say, it's become more nation state centered rather than less nation state centered. And we've seen that with vaccines, like 100% with vaccines. It was basically, and Trump did that, but it wasn't just Trump. UK did that. European nations like Germany did that. Everybody said, okay, I'm going to look after my citizens first. Yes, I'll genuflect to the world vaccination supply, but it's my people first. And so I think there's a lesson to be learned there. Nobody's going to be looking after Canada except Canadians. That's the lesson that unfortunately perhaps has to be learned. And so if we want to have vaccine supply in the future and in some future crisis, we're going to have to manufacture vaccine supply. If we want masks in the future, we're going to have to manufacture masks. And that's
so you bring up something really important, Tony, and I think the key word here that I'm going to want to double click on for a bit is the word resiliency. Right. For years and years and years, and this actually might be part of the GE legacy of efficiency and all of those great buzzwords, is that just-in-time inventory and everything from stock buybacks, and nobody was really being productive, and it was really just a big numbers balloon. And suddenly we got hit with where's all the value, where's all the stuff, and very much of this idea of resilience. So in comes a new company that you are co-chairing called Reshoring Canada.
Right.
And so when we ask that really prolific question is, what do we mean by resiliency? And what are we planning to do to reshore, to bring things back here, to bring back the brains, to bring back the key elements that's going to make this country function? And yes, we may have to give away some efficiency. So tell us a little bit about the concepts there.
Yeah, so let me paint the picture. So Reshoring Canada is a new national organization that is an advocacy and information organization. So I co-founded it with former Alberta MP Brian Storseth, and my co-chair is Sandra Cupatello, who was a former Liberal cabinet minister, trade minister, economic development minister under the McGuinty government. She and I remained friends throughout all of our dueling in the Ontario legislature, and so I'm very excited that Sandra and I can work together on Reshoring Canada. Let me say what Reshoring Canada is not. So Reshoring Canada is not a nativist organization. By that I mean everything has to be made in Canada. Nothing can be taken from anywhere else, and make Canada great again. Or that's not what it's about. We understand sophisticated supply chains and how like our auto sector, cars go back and forth during assembly, go back and forth the border at least 7 times. So there is a need for international supply chains. However, and this occurred to me even pre-COVID when I was working on some business projects involving critical minerals supply chain, rare earth elements, where that supply chain is currently controlled 70% by China. So if you want, I used to make the argument years ago, if you want to build an F-35 fighter jet, you need to have rare earth elements, palladium or lithium or whatever, right? Well, forget that. If you want to build electric vehicles, if you want to have access to electric vehicles and batteries for electric vehicles, if you want Canada to be part of the new supply chain for the new economy, then you got to worry about where this stuff is being built, and it won't be built in Canada if all of the supply chain is somewhere else. So and then came COVID. So I was working on the critical minerals part of it, and then came COVID, and we had this massive crisis on PPE because 98% of it was manufactured in People's Republic of China. So that was at the front end of COVID. And then at the back end of COVID, lo and behold, the federal government, was scrambling around, and I lay no blame on them. I'm just saying that's what happened, trying to find vaccine because there was no ability to produce it short term anyway in Canada. And so they had to make all these international arrangements, which meant that we were a few months behind everybody else. Thank goodness we've caught up. And because Canadians are Canadians, so we have high rates of vaccination. But there was a period of high anxiety, and it could have gone south on us. So I think it all makes the case that we are part of an international economy. Yes. We are part of international supply chains. Yes. But if you care about national security, if you care about the environment, and you care about social health and welfare of Canadians, and if you care about long-term job security, then you do have to care about having more resilient supply chains, where certain aspects of it have to be localized and not just reliant on international supply chains that may not work for us. So that's the birth of Reshoring Canada, and we've got it launched. We've got it. Go to reshoringcanada.ca, sign up, and get our communications and our newsletters. And we're going to be we're just in the midst of finishing off a massive survey of Canadian businesses about their supply chain needs. It's a SWOT analysis, so strengths and weaknesses and opportunities and threats. We've had a huge, great feedback already on that survey, and we'll be publishing that soon, and that'll be the basis for our advocacy, because we wanted to advocate not just, Tony Clement thinks this and Sandra Pupatello thinks that. It's based on some hard evidence that we've managed to obtain through our survey. And then we'll have some webinars and some other events as we move forward. But it's very exciting. And the response, by the way, Natalie, has been very, very positive. And I really didn't know what the response was going to be. Is it too esoteric? Supply chains, does it mean, guys with pencil protectors, in their pocket, what's going to be the reaction? But most of the reaction has been, thank goodness somebody's finally doing something about this, because it's so important. That's the reaction from the manufacturing community throughout. So it's been really interesting.
Well, I think what's really amazing, obviously, is there's so much there's been a whirlwind or a confluence of change that's happened in the past 15 months. Much of what was going to happen has been accelerated, and there's this groundswell of digitization and transformation, and it's all pretty exciting, yet extremely scary. So at the same time, you actually mentioned cyber warfare. There's, businesses, ransomware. It's like a $10 trillion market now. And there's all sorts of geopolitical issues. You mentioned about, the Belt and Road Initiative by China, and now the G7's trying to create the, back to better for the world. I think it was called the B3W or something like this. So there's a lot going on there. And so I think a lot to sink our teeth in. But this podcast is really about health. And so I want to take this down to the supply chain as it relates to health. Now, one of the factors that we sometimes don't consider is oftentimes supply chain is not just the fact that we don't have a manufacturing facility of XYZ drugs and what have you. It oftentimes is stopped at different inflection points, including the whole thing around payments. Drugs are expensive.
Right.
And we know that manufacturers are getting fancier and double, all these CAR-Ts and immunotherapies. And we just heard about mRNA and all the options, the bells and whistles. If we kind of lifted the lid on this thing could be explosive and move from like a 30% GDP to 90%. How do we manage this, I guess the innovation and the discovery, and not preventing it or masking it, while at the same time trying to manage the costs of all of this in this burgeoning healthcare cost system.
Yeah, no, you raise a good point, and I actually during COVID, one of my many books that I've been reading is a great one by the biographer of Steve Jobs. He did another biography called The Codebreaker of Jennifer Doudna, who was won the Nobel Prize in Chemistry for the CRISPR technology and the mRNA research that she and several others were doing. And so his point of view is that the next age, we just got through the information age. The next age is going to be a gene age where so much new technology will be available due to our research into our genetic material and the ability to manipulate that. And there's a whole raft of moral issues involved, obviously, but the genie is somewhat out of the bottle at this point. And if we didn't have mRNA research that had been going on for the last 10 to 15 years, we wouldn't have had these vaccines. There's no question about it in the time scale that we had them. So Canada, what do you want to do? Do you want to be a passenger and an observer in the next revolution of humankind? Or do you want to be an active participant? I think the answer has got to be the latter, which means we do have to have a life sciences sector in our economy. And unfortunately, last few years, it has been slowly gliding away from us, but we're at the hinge of fate here after COVID. Federal government quite rightly announced several $100 million for a new vaccine facility in Montreal. And that's wonderful. But I guess the next question is, how can we create an incentive that works for all these wonderful researchers and scientists and organizations, some university-based, some based in private sector, to also congregate not only just in Berkeley or MIT, but in Canada as well. And I think that's got to be one of our objectives as a nation.
100%. You also in the past helped to develop the Canadian Partnership Against Cancer. Now, cancer is really interesting because especially during COVID, due to the lockdowns, due to the shutdowns, and due to the emergency use of the ICUs, a lot of surgeries were stopped. There was a moratorium on diagnosis, and there's probably a huge bolus of potentially undiagnosed individuals, if not people that might have been rapidly progressing on disease that they may not know or have known that they had. I'm actually just curious about, from the time that you developed that to where you think we are today, what do you think has progressed? What do you think remained stagnant? And where do you think we went backwards on cancer?
Mm-hmm. Well, the Canadian Partnership Against Cancer was a platform commitment by Stephen Harper when he ran in the 2006 election. So when I became health minister, it was part of my mandate letter to create this organization. And it was based on the understanding that a lot of the levers, and you probably know this, Natalie, I know you do, many of your viewers would know it too, but maybe a lot of people don't think about this, but a lot of the levers are actually with the provincial governments. Healthcare is a provincial responsibility. I used to get this problem so much as a federal health minister. I actually laminated a card with the sections of the Canadian Constitution on the card for what is provincial responsibility on one side and what is federal responsibility on others. People would come up to me and say, you're a health minister, we got a problem with this hospital here. And I say, yeah, but that's the provincial government. Well, you're the federal health minister, why aren't you solving it? Because I can't solve it. I'm not in charge of hospitals. I'm in charge of a bunch of federal stuff, including vaccines and things like that, but I'm not in charge of doctors, nurses, and hospitals. People, and I'm not blaming them, but it's just a reality. People think, well, if you're a federal health minister, you can just order Doug Ford's health minister to do whatever you want. Well, no, actually, we have a constitution. So all of which is to say the Canadian Partnership Against Cancer was a federal provincial initiative, understanding that the provinces are the primary place where you treat cancer. But we as a federal government could research on cancer, and we could also come up with best practices, and maybe having a dialogue in a clearinghouse such as the Canadian Partnership Against Cancer could in fact advance our fight against cancer because at least you're in the same room talking about this stuff. I use the same model when I created the Mental Health Commission. Same deal, mental health, provincial, but maybe there is a convening role and a research role that the government of Canada could play.
And everything. And you also talked about national heart and stroke and strategies and initiatives. And there's the whole platform concept, more R&D versus the boots on the ground and getting it done. So with all of that said, you've mentioned that it's the Constitution. Everything has been thrown up in the air. Like I said, the world is a different place today. Geopolitically, we're in brand new territory that we've never found ourselves. Is there an opportunity, or should we open the door to a relook at the Constitution and really sort of rethinking the federal versus provincial jurisdictions on who does what in healthcare?
I don't think that's going to happen. I'll be honest with you. I don't think that's going to happen, because it's never, once you open up it's like a can of worms. Once you open up the Constitution, it's never about one thing. It's about a multitude of things. And then all of a sudden you've got to have agreement on the multitude of things. That's what happened with Meech Lake. And indeed, it was because of Indigenous issues that the Meech Lake Accord, or one of the reasons that the Meech Lake Accord was never enacted, was because of Elijah Harper, a legislator in Manitoba, who was Indigenous, did not give his consent, and they needed unanimous consent. As one example, Newfoundland also dissented. So the sad history of constitutional reform in this country leads me to conclude that it is difficult to do. You could say, the federal government could say, let's have a different arrangement on healthcare. The provinces would say, no. Then what do you do? Because Quebec is never going to say yes. Alberta likely is never going to say yes. In Ontario, we want to get along, and when we think of the government, most Ontarians think of the federal government. Not so in Alberta, not so in BC, not so in Saskatchewan, not so in Quebec. So it's just a different mindset. So I'm afraid, but lots of opportunity. We have to actually sit down, and when we want to solve something like healthcare, we got to sit down with multiple parties and just hash it out. It's part of our system. And so this kind of federalism, we're actually world experts in it, because I guess no one else would have the patience for it. And so that's the way we got to do it. I don't see any grand constitutional plan, but I can see on a step-by-step, case-by-case, issue-by-issue basis coming to better places. And I was interviewed earlier today, and somebody said, "What do you see federalism changing?" And at first I was fairly pessimistic, but they've had like 34 Zoom calls or 54 Zoom calls between the prime minister and the premiers through this crisis. Maybe that's not a bug in the system anymore. Maybe that's part of the system where they're going to have lots of ongoing conversations, not necessarily face to face, maybe once a year face to face, or twice a year. The rest of the time, once a week, whatever. And that could lead to maybe not massive change, Natalie, that you would like to see, but it could lead to some pretty incremental but important wins for the people of Canada.
Yeah, and everything starts with a 1% movement. And one of the greatest gifts we ever had was compounding interest. So that's how all that works, which is interesting. We're living in a world of an aging population. I know that's one of the key detriments to China, as an example, as we all sort of head towards becoming the next world leader. Everything from cryptocurrencies to who's going to own the next, digital currencies and everything in between. But there's rising healthcare costs, but again, the aging population. You mentioned as well that you used to be the Minister of Long-Term Health. We've heard recently about some of the debacles that were been happening in some of these long-term care homes and what's happening. Just kind of curious about your point is, could the aged, or dealing with this bolus of baby boomers getting into the aged, is this going to be a new business opportunity? Are people going to make money on this? And if so, what would be some of those industries and those ideas?
100%. Obviously, caring for people in place is going to matter a lot more. Maybe not long-term care facilities might be necessary for some, but there won't be enough beds for it to be the solution for all. So aging in place is going to be a huge industry. Keeping people healthier longer in their homes is going to continue to grow as an industry. And so I expect to see that. And, baby boomers aging, they've always been, they're used to being driving, economic activity as the biggest age cohort in society. They are no longer the largest age cohort, but they still have the most money. They are the richest age cohort in the history of the world, baby boomers. And so as they age, they're going to have money to spend for that. And so that'll mean different industries. AI is going to be a huge component of this. Robotics is going to be a huge component of this because we just don't have the people power for all of the things that they're going to need. And if Walter McIsaac, the author of Steve Jobs' biography and now Jennifer Doudna's biography is right, then genetic research and the genetics industry is going to be the next wave as we have designer genetic fixes for our bodies that are specific and individualized to ourselves. So yeah, I think there's going to be a lot of interesting new ideas that are going to be coming out and about. And I hope I have not, maybe I haven't conveyed this as well, because we've just got through or are getting through this COVID, situation. But I'm an optimist. I just believe that human beings, when given the ability to create, will create solutions. I believe that's going to be the solution for our environment. I believe that's going to be the solution for many health issues. And it's going to be the solution for social welfare issues. Don't sell human beings short. Yes, we get into messes, but we find ways out of messes if we're given the ability and the incentive to create. That's the.
I love it. And it's such a great description of what we call innovation systems thinking. When you come back to basics, go down to core principles and rebuild using the Lego blocks to create something new. And so there's lots of hope around this. Now, I was also just curious, this is a time and a very exciting time in healthcare, highly disruptible. A lot of things are not working. So this is the time where everybody's going to be flocking in, including consumer electronic companies, big tech companies, the Amazons, the Googles, the Walmarts. We're even getting, car companies. So point of care at home in the car. What's your vision for the new point of care or our new healthcare system in the future?
Yeah, no, I definitely see this. Let me back up and say when I was Ontario Health Minister and Federal Health Minister, they were always looking for what can we sign a contract for that will help us build the best e-health solution. And, I kept looking around going, why is it the government's responsibility to create the best e-health solution? What do we know about e-health solutions? So doesn't Microsoft and Google and all these, don't they have some possible e-health? No, privacy. It's got to be, of course, no comprehensive e-health solution was ever successfully funded by any government anywhere in the world, by the way. And so now I think we're at the point where we kind of realize that if we want to see these solutions that are going to be personalized, accurate, privacy-centered, all of these things, it's going to come from the innovation of the private sector. I can't tell you how many organizations I've already talked to who have, very interesting e-health solutions to COVID or to cancer, or I had a fellow on my Boobin bus who has an app that can identify, you take a photo with your smartphone of some skin lesion that you've got. Gee, I wonder what's that all about? It can identify if it's potentially cancerous, then it connects you with a health specialist. So it's not just you using Dr. Google, but it's a great comprehensive solution for something that concerns people. And that wasn't a guy at the Ministry of Health designing that. That was a guy in Toronto designing that. So I think that's where we're going to see some really interesting innovations that are.
So coming back to the whole systems innovation, we talk
Yeah,
about like the dismantling of entire legacy structures that are basically like trying to move the ship Titanic, right? So it's these little pings, it's these little bullets that are going to go in that are going to, it's almost like water smoothing a rock. It's going to take hundreds and thousands of pounds of water to do it, but eventually it will smooth it out. So this is the opportunity of, and in some ways in the most gracious way, is the forest fire, is that sometimes there has to be ashes for new things to grow. And so this is sometimes, it doesn't have to be that dramatic. It could be something like the washing of water, but we are living in an era of dispersion. I mean, we've never seen such incredible movement that we have since COVID-19, with people moving from urban to rural and all sorts of other things. We're seeing Starlinks, we're seeing the ability to connect in remote areas that we were never able to before. I love the fact that we are seeing the evolution of what you created around telehealth or telemedicine, everything being done online, and all sorts of things in between. I was just kind of curious on that good note about us administering healthcare. Do you have any concerns about some of the negative with this, the brain drain, the increase in immigration to the US, the increase in real estate prices in Canada, and losing some of the traction that we have made in healthcare and in other industries, about losing some of that great brain power in Canada?
There's always a race for talent, Natalie. You're absolutely right. And it's a worldwide race now. It's not just with the US. And so Canada does have to be has to continue to be a place where people want to settle, because they have to settle somewhere. They can't just live in the ether. So yeah, I think we've got to come up with new strategies to attract talent. I think we've got some ingrained advantages just because we have a country of natural beauty, and we have great metropolises, and we've got wonderful, amazing higher education institutions that are world class. So let's not cut ourselves short, but it's not automatic, and that's why we always have to get the startup people here. I'm involved with something with the Toronto Business Development Corporation, where we get these startup folks from India or Pakistan or China or wherever, who maybe want to get a startup visa into Canada. That's their entry into Canada. Well, tell us what your company's all about. Maybe we can help you get that startup company going in Toronto rather than in Lahore, Pakistan, or wherever. So yeah, it's those kind of strategies that are going to be very important in the future.
And you also are a great advocate. You're sitting on and involved with several startups yourself: DG Market, Magnify, Think Data Works, Matri Health. Tell us a little bit about your involvement with these pretty interesting startups.
Yeah, no, I've always, aside from my political life, I'm a lawyer, but I think my true calling outside of politics is with being an entrepreneur with startups, advising them. And so it's great to be involved in some of these. Magnify is a teleconference app from Canada. It's kind of like Zoom, only better than Zoom. And it's more secure and it's more collaborative. So I'm very happy to be chairing the board of Magnify. Matri Health Technologies out of Vancouver emerged from COVID, the early stages of COVID, and wants to have technological solutions for healthcare developed in Canada by Canadians. So I'm very excited to be part of that. Think Data Works, I'm an advisor to them. They're kind of moving beyond startup. They've got 50 plus employees now, and they're in the big data environment, how to attract big data and to analyze it for companies and for governments. And startup, it's been started by a gentleman by the name of Brian Smith, who started out as a staffer in my office when I was president of the Treasury Board. So it's very exciting to see these young people do something really, really neat in the private sector as well as the public sector. So yeah, no, that's part of who I am, and I'm very excited to have that window into some very interesting technology and some very exciting entrepreneurs.
Absolutely love it. We could literally speak to you for hours. So much brain power, so much experience. I'm hoping this conversation continues, Tony. We all need it. We're at a highly disruptible and exciting opportunity for change, and we're really rooting for it. For anybody listening to the show who's interested in connecting with Tony for a myriad of reasons, background, consulting, looking to get into the ecosystem, looking at, having a startup and trying to figure out how to come to Canada, Tony is the guy. So please look for his contact details. We'll be leaving those in the show notes. If you also enjoyed this, we encourage you to check out impetusdigital.com. This is the kind of thing that we do in our platform, asynchronously or over time, or synchronously live meetings with payers, patients, allied healthcare providers, physicians. We bring people together to solve these big, hairy, audacious questions, moving the needle ahead on policy, legislation, work, concepts, brand strategy. This is what we love to do. We'd love you to check us out. Please like and subscribe to our channel, and we would really appreciate if you could leave us a review on iTunes. Thank you, everybody, for your time. Tony, outstanding work. We wish you all the success and love to hear what's going on with Reshoring Canada. And thanks, everybody. Have a wonderful day ahead.